Okay, this video is about trigeminal neuralgia, and in particular we're going to talk about dental origin related to the teeth. That's also called odontogenic trigeminal neuralgia. Here's a trigeminal nerve. It is also called cranial nerve 5. It's called trigeminal, tri as in 3. There's the upper branch called V1, ophthalmic, over the region of the eye. Maxillary is called V2 because the bone in here is called maxilla, just beneath the nasal cavity. And then V3 is mandibular, the purple here. Okay. Here's a more detailed anatomical drawing, and what you should get from this is that the nerve is inside the bone and it goes directly to the teeth. That's a key point. The nerve goes to the teeth. So these people who have trigeminal neuralgia have severe pain in their face, most often in the V2 level. However, you can get referred pain from the V3 level that will present with V2 level pain. That's very common, and we're going to talk about that more in just a moment. I want to show you the conventional approach to trigeminal neuralgia. It is to obtain a thin section MRI of the brain with emphasis on the posterior fossa. That means the level of the brainstem. So here's a robust looking cranial nerve 5 on the right side, whereas the cranial nerve 5 on the left side is a little bit atrophic, meaning smaller than it should be. And what they see is here is an artery. It's a branch of the left superior cerebellar artery. That doesn't matter. All that matters is there's an artery that's contacting the nerve. So this raises the concern, is the artery pushing on the nerve, causing the pain? And I'm going to tell you, why do I personally think this diagnosis is very overrated? Because this artery has probably been sitting next to that nerve for a long time, perhaps ever since that patient was an adult. Now, it is true that arteries can change as a person gets older. As a person gets older, they accumulate atherosclerosis. They have perhaps had chronic hypertension. That can lead to a little bit of increased tortuosity, curvature in the artery. But I'm just telling you, be suspicious of high-tech stuff, okay? You only want high-tech when, low-tech and common sense don't work for a situation. So anyways, if they think that, and believe me, I'm going to get to something much simpler real here, but you have to know the baseline first for everything to make sense. So the common surgical approach is to say, well, it appears this artery is pushing on the nerve, therefore we're going to put a little cushion in here, a little sponge, to soften the pressure of the artery on the nerve, distribute the pressure over a larger area, and thus minimize the symptoms is the goal. And sometimes the patients do respond well to this. However, this is certainly a very big deal. One has to do a craniotomy, so behind the ear, retroauricular craniotomy through the occipital bone into the posterior fossa of the brain. And here is the brainstem, the pons, trigeminal nerve coming out, and this is a little sponge they put around. Here's a magnified picture showing the sponge placed in between this artery, let's say superior cerebellar artery, and the trigeminal nerve, cranial nerve 5 on the same side, okay? That is a major surgery, okay? There's other things that have been tried, putting metal devices in there and using radio frequency, a glycerol rhizotomy, radiation therapy. I just want you to see how incredibly big these procedures are. By the way, this radio surgery bills for $25,000, and I don't know the price for craniotomy. They call it microvascular decompression. I don't know the price of it, but you could bet if radiation therapy costs $25,000 that this probably costs far more than that. I don't know the price. I would get it's probably at least $100,000 would be my guess, but I don't know. Okay, so I just want to show you the dental perspective on this. This is a very good book here. It's called The Garbage Collector by this guy, Robert Gamal. He's a dentist. He's retired now, but he's in his 70s. And let me tell you something. You know who writes the best book? Old guys. And you know why old guys write the best books? Because they don't give a crap. He's done. He's retired. He was a regular dentist the first about 25, 30 years of his practice. And the last 20, he became what's called more of a biologic dentist, in the sense that he studied everything and he realized there's so many things that could be done better in dentistry. For example, that all root canals are infected and they should come out, because if you have a dead infected tooth, it's going to cause problems. So anyways, Trigeminal neuralgia, severe lancinating pain, most often in V2 distribution, meaning the middle of the face, like the level of the maxilla. Females get it more than men. They're usually over 50 years of age. Most of the time you can't see it on an x-ray. You might see it if you do a special dental CT. And just like leaky gut causes bacterial toxins to get into the blood, making the blood a little more prothrombotic, prone to clotting, increasing the risk of heart attack. It's the same thing with dental infections. It can be a root canal tooth. It can be a cavitation around a previous tooth removal, especially wisdom teeth, especially the molar wisdom tooth, number 3 molar that's, let's say, an impacted wisdom tooth or something that was then subsequently pulled, extracted. Doing this dental stuff is much easier. All they have to do is squirt local anesthetic around the tooth that they think is the causative one. Typically, it's going to be a mandibular molar, 3rd molar, extracted wisdom tooth, for example. And if the pain goes away, that's good evidence that that's what's causing it. If you just inject it at V2 level for V2 symptoms, you don't know if you just anesthetize the nerve. But when you inject it at V3 level with the referred pain and that going away, that's stronger evidence that what you need to do is clean out that site. They often call it a cavitation site. And what it really is infection of the bone. Osteomyelitis is the medical word for infection of bone. It's especially due to anaerobes. Now, you can't just easily treat it with antibiotics because the infection tends to be under pressure, and a lot of times you don't have good enough perfusion, blood supply to the infected bone to have it reached in adequate amounts by antibiotics, even intravenous antibiotics. So the best treatment is surgical debridement. A few other points to make. Here's one paper on the subject. They sometimes call it NICO, as a fancy medical descriptive word for the infection of the bone. Neuralgia-inducing cavitational osteonecrosia. It really would be better if you call it cavitational osteonecrosis inducing neuralgia. So here's the reference here in this medical journal. In this book, Gamal, he writes all about it, odontogenic trigeminal neuralgia, on page 198, pages 216 to 221, etc. There's an organization called the IAOMT, International Academy of Oral and Medical Toxicology. You can look them up very easily on the internet. Just type in IAOMT.org. There's a good lecture online, even on YouTube, with this guy, Stuart Nunnally, talking about how he's got incredibly good results for many hundreds of patients by cleaning out these cavitation sites from previous extracted wisdom teeth, so to speak, molars, 3rd molar in the mandible. So most often, the clinical word you're often going to hear, when people talk to patients, they don't use these fancy medical words. The word they usually use is cavitation site. And that sort of means the cavity left by the tooth that's been removed with infection of the surrounding bone, the socket, the empty socket infection of the bone. So this is rather extraordinary. What I'm trying to say is understanding this can protect many, 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 many patients from unnecessary brain surgery or brain radiation, okay? This is a wonderful thing to be aware of. And up until recently, organized dentistry used to hassle these guys for doing this procedure, despite the fact that it's quite well documented in the medical literature. And if you go to PubMed, I was kind of a little bit annoyed that most of the papers on it, there is no abstract. Usually what's happening when there's no abstract is you're being blocked, in a sense, indirectly by a paywall. What that means is, let's say a corporation publishes a site and it wants people to know about it. It makes sure that it's available free to the public, versus when they want something hidden, it gets blocked behind a paywall because most people aren't going to pay to see the entire article. This is a great book if you're interested in dentistry. I've read a whole bunch of books about dentistry. This is a great one. It's really, I think, the best one. There's some other ones that are really good too. They've got unique insights, but this one's rather extraordinary. It's very well documented. Anyways, I just wanted people to know about this. Lots of people suffer terrible pain, and then they go for procedures that don't work and are very expensive, when there very often might be a cheap procedure. It's not cheap, but it's very reasonable with your insurance especially. It probably costs about $2,500 to get surgical debridement of the infected bone, and that's the most likely thing to cure it. This one dentist who does a lot of these, he felt that 90% of trigeminal neuralgia was due to this. Of course, you'll probably read other estimates and other articles, but trust me, in the world of neurologic problems, this is a big deal and it's good news.